Hello. So today I'm going to talk about holistic management of infertility. Now what do we mean by holistic management of infertility? Basically, over a period of more than 25 years I've been using homeopathic remedies to manage infertility problems, and we see that infertility is absolutely on the rise. There are a number of factors because of which it is on the rise, and we have seen that an integrative approach or an holistic management towards infertility is what really helps in today's world. So we will look into this, we will look into the various aspects that we use, we will look into all the natural techniques also that I'm using for managing these kind of problems successfully. So let's begin. The first thing is that what do you define infertility as? So when we say that there is failure to conceive within 1 year of regular unprotected intercourse, this is known as infertility. Now there could be two types here. One is primary infertility, where the woman has never conceived, and then the secondary infertility, where there is evidence of previous pregnancy but failure to conceive subsequently. So and we have seen that there are various factors which are responsible for it. So we find that there are tubal factors, there are factors of ovulation and endometriosis and other related issues. So the first thing is tubal factors. Around 25 to 35% of female infertility is because of problems with tubes. So the fallopian tubes are either completely blocked, either partially blocked, or there are some problems of the fallopian tubes. The second and most important thing is ovulation factors. Now here we have around 20 to 25% of cases where we have ovulation factors which are responsible. So here we have conditions like PCOD or unovulatory cycles and things like that, which come into under this category. And the third one is endometriosis. So around 1 to 10% of all cases have something to do with an pelvic infection or endometriosis as a result of previous infections, etc. So here now today I'm going to talk to you mainly about problems of female infertility. That is the major thing that I'm going to talk about, and also I'm going to talk about certain factors which are more relevant to male sperm count, etc., etc. So why is it that fertility problems are on the rise? Now we see that 1 in 6 couples find it very, very difficult to conceive, and quarter of all pregnancies end up in miscarriages. Now there are multiple factors. One is the physical, second emotional factors, there could be stress, there could be personal habits. Now why is this on the rise? It is on the rise because nowadays we see that women are multitasking. Gone are the days when she would, just cook for the house and look after the children, or just look after the household and cooking. Now she is, working in the corporate world, doing corporate jobs, staying late at night, and doing all these kind of things which are actually causing a lot of stress on her. Apart from this, she also has to cook in the house. So this multitasking is leading to a lot of stress, which is eventually leading to unovulatory cycles or dominant male hormones, etc., etc. in women. So let's look at all these factors one by one. So basically what happens is that when there is increased amount of stress, then adrenaline and cortisol is released more, and that results in irregularity of periods, unovulatory cycles, PCOD, and subsequently infertility. When we consider about stress in men, it is equally affecting them because they are working late at night, they are having targets to achieve, they are smoking, they are doing alcohol. All this leads to an increased stress, causing low sperm count and abnormal sperm count. So we have to look into all these factors when we are talking about management of infertility. Now what we see is that what is important is that the preconception period or preconception care is very, very important. So we have to understand, and we have to educate our patients that it takes at least 3 months for immature eggs or oocytes to mature enough to be released during ovulation. And it also takes at least 3 months for sperm cells to develop ready to be ejaculated. So this 3-month period is very, very vital. So this period is called as the preconception period, and a lot of care and attention needs to be given during this period, because medicines alone do not help, and we have to look into factors that are really affecting the entire fertility journey. So we have to look into the lifestyle factors, modify them if required and as required, and only then we will be successful in treating the infertility cases. Many times we feel whether supplements are required and what is the role of supplements. A lot of our homeopathic doctors believe that only a homeopathic remedy should do the trick, but now we understand that infertility is multifactorial, and unless and until we correct these factors, we are not going to get good success. So along with your indicated homeopathic remedy, it is very important that you look into what the supplements can do. So here is a list of few supplements which will help and which we should take into account when we are dealing with infertility cases. So first is folic acid. Now, it is known fact that folic acid and B complex together are essential to ensure that the baby's genetic growth or the genetic code remains intact. And it is also known that folic acid improves the sperm count. So we have to see that the patients we are treating do not have folic acid deficiency. The other element is zinc. Zinc is also a very essential component for genetic material, and zinc deficiency can cause chromosomal anomalies or chromosomal changes, and this could reduce the chances of fertility and in fact increase the risk of miscarriages. In men, zinc deficiency can cause low sperm count. So we have to remember that folic acid, zinc. The third supplement is selenium. Selenium is an antioxidant and it protects your body from high reactive chemical fragments such as free radicals. So for this reason, it is very important that you have selenium in your diet as well. So selenium can prevent chromosomal breakage, which is known to cause birth defects, and it is known to cause miscarriages. So all these trace elements are very, very important when we are trying to treat infertility cases. Omega-3 fatty acids. Again, omega-3 fatty acids are known to control inflammation, which is very prominent in infertility cases. It is very, very prominent in cases where women are suffering from endometriosis. So to control the inflammation, which may interfere in getting or staying pregnant, omega-3 fatty acids are very important. So is vitamin C and vitamin E, because vitamin E is again a powerful antioxidant and has been known to increase the fertility both in women and in men. On the other hand, we know that vitamin C, which is very commonly available in lemons, is known to enhance the sperm quality, and it is actually acts as a protecting ingredient for the sperms, and the DNA damage is prevented. So adequate amount of vitamin E and vitamin C are also very, very important. It also is known that vitamin C can prevent the clumping of the sperms together, and it can make them motile. So in case sperm motility is an issue in your case, please ensure that vitamin C is given in adequate amounts so that it will help in the sperm motility. Now, when we come to homeopathic remedies, of course, I'm going to discuss few homeopathic remedies which are conventional homeopathic remedies which most of us use. For example, natrum muriaticum. This is the most frequently used homeopathic remedy and most frequently prescribed. It is known for its diminished sexual desire, aversion to coition, dryness of vagina, and in anemic women with dry mouth and dry skin. So when you have such a case, you can give natrum muriaticum as a constitutional remedy. Of course, the other mental aspects of natrum muriaticum are well known to all the prescribers, so I'll not highlight on those. The next remedy that is again often used is natrum carb. Now, natrum carb is used, and it is given in our literature that it is the best remedy for non-retention of sperms and aversion to milk. And the woman who requires natrum carb also has leukorrhea, which is preceded by colic. So these 2-3 indications are the key indications for the use of natrum carb as a remedy. Next remedy I'm going to talk to you about is Sepia. Again, Sepia is one of the popular remedies that we use. It is known for dominant male hormones. It is known for irregular periods and absence of ovulation. So when you see a typical Sepia woman, she will have abnormal hair growth on her face because of excessive male hormones present in her. Then there will be absence of ovulation. The typical keynote that we also see is that must sit cross-legged. She'll have painful intercourse and also vaginismus. When you think of these indications, you could think of Sepia as one of the constitutional remedies for infertility in women. Another remedy which is now gaining a lot of popularity and it is really being very, very useful is a combination of Aurum metallicum and Natrum muriaticum. So Aurum Mur Natronatum is the remedy. Now this remedy has a smile on her face, but there is deep grief within. So you can imagine that it is a combination of Aurum Mur, Aurum Met and Natrum muriaticum. So all the mental aspects of both these remedies are seen in this one remedy. So this is a very, very good remedy for induration of cervix and induration of ovaries. It is a wonderful remedy for enlargement of uterus. It is a very good remedy for women who are suffering from hypertension and who want to conceive. And also it is a wonderful remedy for women who have fibroids, and because of those fibroids they are unable to conceive. So Aurum Mur Natronatum is this remedy which you can prescribe in such cases. When we go ahead, we find a remedy called Bovista. Bovista is known for its allergy to cosmetics, and Bovista is also known for infertility, and Bovista is known for the dreams of being bitten by snakes. So when you have a woman who is very allergic to cosmetics or to any external applications and who is suffering from infertility, then this is one remedy that you should think of. Another very common remedy that I have been using is Aletris. Now Aletris also is a remedy which has got sterility because of leukorrhea, and Aletris is a remedy which has got atony of the uterus. So when you think of this combination of leukorrhea, which is preventing her from getting pregnant, and sterility because of uterine atony, that's the time when you should think of Aletris as one of the remedies. Now, of course, these remedies are all well proven, so I would suggest doctors that they should go and individually read the provings of these remedies and all the indications from the source books. But I'm trying to bring in here the remedies which I have been really using over the past 20-25 years, and I've been finding them very useful. Now, of course, in my cases, I have not used only this particular remedy or only one single remedy at a time. At times we have to change from one remedy to another. At times we have to give something specific during ovulation. All these things I'm going to share in the presentation further after we finish sharing about the various remedies that I've been using. One more remedy that comes to mind is Abel Moschus. Now Abel Moschus again is a wonderful remedy for infertility, and where there is an issue of vaginismus and a lot of fear of animals. I'm seeing a lot of young women now having painful sexual intercourse, or that's the complaint that they have, because of which they are unable to have sexual satisfaction, because it causes a lot of pain, and thereby it does not result in or it rather prevents them from getting pregnant. So when you think of a combination of vaginismus with irrational fear of animals, etc., that's the time when you can think of Abel Moschus as one of the remedies. When you have an obese patient who is chilly, who has decided aversion to coition, who's prone to constipation, and who's got induration of ovaries, that's the time when you can think of Graphites as one of the remedies, because Graphites is known for its obesity, for its constipation, for its aversion to coition. All these are classical indications of Graphites. To add to this, of course, if the patient has skin complaints, then surely Graphites will work wonders in such cases. Another remedy that we are commonly using nowadays is iodine. We are seeing a lot of cases where there is a combination of infertility and thyroid issues and PCOD. So, induration of glands, especially the thyroid glands, PCOD, and dwindling of mammary glands and losing flesh while eating well is the classical keynote of iodine. So, iodine is the remedy which you should think of when you see a case where there is thyroid involvement, or in PCOD related infertility cases, iodine could do wonderfully well. One more remedy which is there for PCOD is an infertility related to PCOD is Conium. Conium has got enlarged ovaries and lancinating pain. It has got excessive hyperesthesia of the genital region. So again, this is one remedy which you can think of when the patient has got vaginismus as well. And there is a lot of suppressed sexual desire. One, because of the hyperesthesia or the vaginismus, and secondly, Conium itself has a low sexual desire in its proving. This is one of the symptoms that has come. So when you think of a PCOD case which has got enlarged ovaries, which has got lancinating pain, which is got suppressed sexual desire, you can think of Conium as one of the remedies. Folliculinium is relatively a new remedy which we are using in combination now. As I said, in certain part of the menstrual cycle, to stimulate the follicles and to stimulate the release of ovum. So whenever the ovaries are exhausted after repeated infertility treatment, what we are seeing nowadays is that a lot of women are coming to us with problems where they have been extensively treated by allopathic treatments, and they have been repeatedly abused with hormones and other such treatments. Now when such a case comes to you, you can think of Folliculinium as one of the remedy. It is the remedy for estrogen dominance syndrome. It is the remedy for overuse of contraceptive pills. It is the remedy of for women who are craving for sugar and wheat. So those women who crave for refined carbs and who have been overusing contraceptives, this is a wonderful remedy to begin the treatment with. Borax. Borax, on the other hand, favors easy conception. With the history of membranous dysmenorrhea and anxiety of future and anxiety or fear of downward motion, and very, very sensitive to external sounds, Borax is one of the remedies which can really favor easy conception. Another remedy which comes to mind, which we have used successfully, is Lilium Tigrinum. Now, Lilium Tigrinum is again having congestion of the uterus, and there is a typical bearing down sensation in the region of the uterus, where she feels that she must support her vulva by the hand, otherwise the uterus will escape. So this is a very typical symptom of Lilium Tig, and one should think of this remedy when you come across such a person who is having this intense bearing down sensation, so much so that she feels that she needs to support it with her hands. An important remedy from the mineral kingdom, Platina, is very well known for its mental symptoms, for its haughtiness, etc. But it is a remedy for nymphomania, for induration of uterus, and again hypersensitivity of genital areas. So Platina is something which you cannot miss. When a patient of Platina comes to your OPD, I'm sure you will very, very easily identify such a woman. Now another remedy which is again very frequently indicated and used nowadays in treatments is Aristolochia Clematis. Aristolochia Clematis is a combination of pulsatilla, sepia and arnica, where pulsatilla features of sensitivity and history of domination of sepia and history of injury of arnica. When such a combination exists and when there is overuse of contraceptives, then you should think of Aristolochia as the remedy. So this is a remedy for sensitivity, for domination and for injury, and this particular woman will feel better during menses and aggravated after menses, very typical of Aristolochia, and there are mood swings as well. Kali bromatum is one more remedy where we see PCOD with a lot of acne, and Kali brom is known for its painful acne. So when there is a combination of infertility because of PCOD with acne, then you should think of Kali bromatum as one of the remedies. Drowsiness, then fear, better when occupied, and a lot of guilt and fidgety hands is the feature of Kali bromatum. Epis, again a wonderful remedy for PCOD cases, especially right-sided ovarian induration and cysts in the right side of the ovary, awkward, jealous girls, absence of thirst, ovaries are numb and congested, and there is a typical burning and stinging pain, which is the hallmark of this remedy. And as I said, it is one of the remedies for right-sided ovarian cysts. Magnesium muriaticum. Magnesium muriaticum is known to be a very good salt in endocrine disorders. Its action is primarily on the uterus and liver, and it is got dysmenorrhea, which is better by lying on the back, and typically lying on the back on a hard pillow. So she will try and take a hard pillow below her back for support. That's what makes her feel better. And one more very typical symptom is eructations tasting like onions. So this is magnesium muriaticum. It is an excellent remedy to balance the disrupted endocrine glands, and it's a wonderful remedy which acts on dysmenorrhea, which is specifically better by lying on a hard pillow. Cenchrus is one of the remedies from the animal kingdom. It's a snake, and it has got history of sexual abuse. So when you have a girl who has got sexual abuse as one of the history, or sexual malhandling, this is one of the remedies which you should think of, because this kind of a experience that a woman goes through leaves a major impact on her, leading to a guilt complex and leading to a feeling that she's not good enough, etc. And so even if the history of sexual abuse is remote, one should think of this remedy when there are typical snake features, and when there is infertility, and when there are dreams of rape. So in such cases you should think of Cenchrus. Another remedy which is now again used is testosterone. Testosterone is a remedy, it's an hormone present in men, but many of our PCOD cases we see that there is dominance of testosterone in women. So typically they will have infertility, they'll have increased facial hair, they'll have increased body hair, they'll have male pattern baldness, lot of water retention, lot of acne. When you come across such a case, you should try and use this as one of the remedies, or often I have used it as an intercurrent remedy. Now again, Folliculinium, previously I already explained about Folliculinium, but the Folliculinium person is a person who feels that she's controlled by somebody else, she is out of her rhythms, that she's living somebody else's life, and she feels that she's very fed up emotionally and psychologically. She is one woman who will talk about being treated like a doormat. So this is a very typical expression given by Folliculinium, and when these expressions are found, Folliculinium should be used either as an intercurrent or either as a main constitutional remedy as well. Now, folliculinum also has a very strong link with carcinosin, and folliculinum is known to work well when carcinosin is indicated but does not act. And so this remedy can be used as a remedy when your folliculinum has not acted. So carcinosin also becomes a very good intercurrent remedy which you can use. Now let's look at some cases. So this is one case which consulted us for infertility and varicose veins and dysmenorrhea. Her detailed case was taken and Lacasis 200 was prescribed. During the course of treatment, she developed severe vulvovaginitis and complained of itching and discharge which was curd-like. And pathological examination of the discharge was done and it was found to be positive for Candida. So we gave her Candida 30 for 5 days as an intercurrent remedy. Next month there was no vaginal itching and the period was normal. So we put her on SL placebo and she conceived by the next month, and by the 8th month again she had a similar infection. So we again gave her Candida albicans twice a day for 5 days, and with this she completely had a relief of the distressing symptoms and later on went to deliver a healthy baby boy. Why I am sharing this case is that a lot of these remedies are indicated and are used as intercurrent remedies, and they should be used, because otherwise many of the homeopathic colleagues feel that giving just one remedy and waiting and watching is what we should do, but unfortunately that doesn't work in all cases. So here are few indications of Candida. Here is all the information. This information is found in the various materia medicas, and there is even posology about it and how it should be used and when and which potency should be used is there in our materia medica, especially Murphy's materia medica, and all these books are available in our major softwares. So in fact I think they are very easily available in the Zomeo Ultimate software as well. So I would also recommend that everyone should have a connect with these source books and these softwares, because these are going to give you the latest information and give you latest provings and all the information about the new remedies as well. So this is about Candida. And now we talk about another remedy, which is progesterone. Now again, progesterone is an hormone which is naturally secreted, and it is an endogenous steroid, and progesterone is involved in an healthy menstrual cycle, and also it is very essential for sustenance of pregnancy. So progesterone tends to promote vaginal dryness by counteracting the effect of estrogen. So there is a constant balance between estrogen and progesterone which is required, and progesterone also decreases the amount of menstruation, or it can block menstruation entirely by reversing the action of estrogen and the effect of estrogen on the lining of the uterus. So progesterone can also cause some medical conditions to worsen. For example, many pills that are given to women for infertility treatment are typically progesterone pills. So they can cause certain things like asthma, heart failure, epilepsy and migraine to increase. So if your case is a case where she is complaining of these symptoms, you should try and inquire how long she has been taking progesterone, and you should make changes to your prescription accordingly. So progesterone, the mental symptoms of progesterone are loss of concentration, inability to think, inability to make decisions, anxiety, a very antisocial kind of behavior, panic attacks, very emotional. All these symptoms are typically seen in the proving of progesterone. So when you see these kind of symptoms in a woman, you can use this as a remedy, as an intercurrent remedy, to put the patient's endocrine system back on track. And it can be given specifically as well to reduce excessive bleeding, or in the later months of when the patient conceives, you can give it to preserve the pregnancy as well. Low levels of progesterone also affect our mood, and they can cause irritability, they can cause anger, it can cause dizziness, headache, etc. So progesterone is one remedy which we are now using as an intercurrent remedy in infertility cases. Thyroidinum is one remedy which is again very much indicated in today's cases where infertility is on the rise. And typically when infertility is on the rise because of thyroid issues, because of oral excessive use of oral contraceptives, patients who are obese, who have thyroid problems, who crave for sugar, all these kind of cases, you can think of thyroidinum. You can either use it as a constitutional remedy, or you can use it as an intercurrent remedy. One new remedy which we have seen is metformin. Now metformin is something which the allopaths use when they see cases of insulin resistance. So in such cases we can use metformin if we see that there is a lot of problems in the liver metabolism, there is PCOD with weight gain, there is insulin resistance. Then you can use this remedy, or even insulinum. Now these remedies have to be used in 3x or 12C form, because in such cases where there is lot of predominance of features where the liver is not working well, or there is a lot of weight gain, there is a lot of acne and insulin resistance, then you cannot give them in higher potencies because it will not act. So these remedies, mainly metformin and insulinum, have to be given in lower potencies. Now there are certain herbs that we use as a routine, and these herbs are very useful in cases of infertility. For example, and many of these herbs are also available as homeopathic remedies. So for example, Tribulus tristis. Now this is one remedy as a homeopathic remedy also. So I use it many a times in mother tincture form. Now Tribulus is one remedy where I use it for regulation of ovulation and also to increase testosterone in men. So we give the mother tincture form 5 to 10 drops morning and evening for 3 months. That does the trick. Again, another remedy is Agnus castus, which has got a wonderful action on hypothalamus pituitary ovarian axis, and it helps in ovulation. There is yet another remedy which is known as Dong Kui. Now this is a Chinese remedy. It is used in Chinese medicine a lot. It increases the blood flow to the reproductive organs. So when we are thinking of cases of infertility, these are certain herbs that we use as support herbs depending on what we see the problem is in that particular case. Maca, for example, is yet another remedy which can increase the progesterone levels. It can nourish the endocrine glands. It can increase the sperm count. So when we have these kind of issues in the couple who is taking treatment for infertility, then we use these specific herbs also. And also well known are ashwagandha and shatavari, which are again used to boost up the uterine function, to boost the ovarian function, and to strengthen the uterus and the ovaries and the entire menstrual cycle as well. Now I also spoke about endometriosis. Endometriosis is a very common gynecological condition, and it is after fibroids. It is one of the major things that affects the female fertility, and it is one of the major causes of infertility. The woman who is suffering from endometriosis gets a lot of pain and painful cycles, painful intercourse, so many problems she can have. So this is said to be associated with estrogen and its in dominance of estrogen, and this incidence of endometriosis is really on the rise. So essentially it is a condition where the endometrium gets implanted outside the uterus, and it can be implanted anywhere from the pelvis to the ovaries to the fallopian tubes to the intestines. And each time the woman gets a menstrual cycle, the area where the endometrial tissue is attached starts responding to the changes in the hormonal cycle, thereby causing internal bleeding and thereby causing a lot of pain. Now, in all my cases, as I said, I am using an integrative approach where the medicines that I use are homeopathic medicines mainly, and natural supplements. But on the other hand, I am into correcting their food habits, asking them to do a lot of exercise. So I would like to share this as well. So a lot of fertility cases, what we prescribe is that they should eat a lot of organic vegetables and fruits. We ask them to avoid milk, because milk is also now injected with a lot of hormones, and so we ask them to avoid milk totally. Alternatively to the milk, cow's milk, we have almond milk or coconut milk which the woman can use. We advise them to eat only grain, that is whole grain and in natural form. We advise them to refrain from refined sugar, and we advise them to drink a lot of clean water, and specifically important foods for fertility. So what are they? Now, the best fertility boosting foods are a lot of seeds and dark leafy vegetables. So we'll look at certain seeds which are commonly used, and what are the resources, or what is it that they contain that can improve the chances of fertility. So let's say the best for omega-3, walnuts, flax seeds, hemp seeds and chia seeds are the best seeds for natural omega-3. So what I typically tell these women is to make a mixture of these seeds and eat it at least 1 teaspoon morning and evening. Then the best natural source for zinc is pumpkin seeds and sesame seeds. So when we are thinking of zinc deficiency, these are the two seeds to look at. Best seeds for vitamin E are sunflower seeds and almond. And again, for iron, there are pumpkin seeds and sesame seeds. In addition to that, we tell them to eat dark leafy vegetables which are rich in iron, folic acid, B6 and vitamin E. Fruits with vitamin C, and they contain, these fruits and flavonoids contain a lot of antioxidants and lot of vitamin C. And as I said, we advise them not to eat refined sugar or caffeine or soya. There are certain techniques that we make them follow, certain yoga poses which are known to increase the chances of fertility, because they are known to improve the pelvic blood supply, and they are known to improve the or reduce the blockages that are there around the fallopian tubes, etc. So I will just enlist these asanas here. So the first one is Paschimottanasana, which stimulates the ovaries and the uterus, and the forward bend in this asana stretches the muscles of the lower back and the hamstrings, etc. This is a very good exercise for fertility. It relieves the stress, it relieves depression, and it increases your chances of fertility gradually. Second is Hastapadasana, standing forward bend. Again, this will improve the blood supply to the pelvic region and the nervous system, and it will help relieve the abdominal area or the spinal cord area and make it more flexible. Janu Shirasana, or one-legged forward bend. Now this is again useful during pregnancy and during the fertility journey, because it can relax the muscles of your back, and it can release the tension around the lower back. Baddha Konasana, again known popularly as a butterfly pose. This will help relieve all the toxins in the pelvic area. It will help relieve all the negative energy. It will improve the blood circulation in around the pelvic area, especially make more oxygen rich blood available to the pelvic area, to the uterus, to the ovaries, etc. So this is a wonderful pose, Baddha Konasana, and coupled with Sarvangasana, this is a wonderful combination. The Baddha Konasana and Sarvangasana done together can increase the chances of fertility. So we should advise all these kind of techniques to be used in conjunction with homeopathic remedies. There's another asana, legs up the wall, or Viparit Karni. Again, this can increase the chances of conception by relaxing in this posture after sex. It would really help you to retain the sperms as well. So this is a wonderful asana, Viparit Karni, and it is very, very easy to do. So there are various asanas like this, and there are various breathing techniques as well which we advise them. And so for example, the Cobra Pose, this also strengthens the back muscles and it stimulates the hormone production in the uterus. So it's a very easy pose to do, and it is very, very beneficial. I would quickly like to go and share some cases which were struggling and which have been helped with the combination of homeopathic medication as well as the other techniques which I discussed. So this is a case of SB who was struggling, trying to conceive for a couple of years, and with the homeopathic constitutional remedy, her cycles regularized, the periods became normal. She started yoga which was advised to her, and within the next 1 or 2 months she was pregnant, and she was happy because she had been trying to conceive for quite some time. This case, what was important was the relationships were very, very important for her. She was very much attached to her husband, and husband was like a friend or guide to her, and there was a lot of brooding. So natrum muriaticum was the remedy which was prescribed. Here is the ultrasound report which talks about how she responded to natrum muriaticum. This is a case of a couple who had come. The husband and wife came. They were wanting to conceive. The wife had PCOD. The husband has premature ejaculations. They have been trying since 2015 with no success. The wife was already taking metformin for her PCOD problems. But still the issues of irregular periods were not solved. She was a very emotional lady. In her initial years of marriage, she had a lot of problems with her mother-in-law. And on the other hand, the husband had psychological issues and also premature ejaculation. Here we did a full case study of both and prescribed homeopathic remedies considering the emotional aspects, physical aspects, etc. 6 months of homeopathic treatment, nutritional guidance, etc. resolved their problem. She became more confident and she conceived. And when when this presentation was being prepared, she was around 4 months pregnant, and she is enjoying her pregnancy. So the understanding in this case is that there is a lot of confusion. There was weight issues, there was insulin resistance, and there was PCOD with irregular periods. So Calcarea carb was the main constitutional remedy, and Syzygium jambolium 1 TDS to reduce her insulin resistance was prescribed. And for the husband, we gave him Kali bromatum because he had guilt and he had erectile dysfunction, and he would feel that God would punish him for his deeds. So Kali bromatum was the remedy which was chosen for the husband. Here are the reports of the patient, and eventually you can see that she has conceived and she's continuing that pregnancy. This case of Mrs. YK, who was struggling for secondary infertility and had met many doctors for the same. investigation showed that the tubes were partially blocked, and that was the main issue according to the doctors. And she actually was coming for her daughter for treatment of asthma, but then she asked me whether I could help her, and then we did a detailed case. We told her to change her lifestyle. We gave her certain yoga poses to be done. We changed her nutrition, and she gave up the bakery products, refined sugar, etc. And we added certain specific remedies during her cycle. So from day 5 to day 10 I gave her Uferinum, and day 11 to day 14 I gave her Folliculinium. And with this kind of combination, also we gave her the remedy Thiocinaminum, because Thiocinaminum is one remedy which can resolve the tubal blocks. So this and Syphilinum as an intercurrent remedy was given, and this helped her to conceive and eventually deliver a baby boy. Another case where the USG shows polycystic ovaries, hair growths on the face, and periods were absolutely normal, but the flow was less, and she just wanted to conceive. So with the history of excessive hair growth on her face, etc., she was given testosterone as one dose. So 1 ml of testosterone every month for 3 months. Okay, and with the help of that, she could conceive. Now this is a case of Mrs. AJ, who came to us, who had desire for salty and home cooked food, and who liked things like pani puri and these kind of things. So she likes sweet and salty home cooked pasta, chaat, pani puri, and a typical type of chana that she would prefer, and she would prefer being by the seaside. So this case we began with Medorinum as one of the remedies. We gave her 1 ml 1 dose every 2 months. 1 ml 1 dose every month for 2 months, and then Thyroidinum was prescribed 1 BD 1x, and with the help of this she conceived and eventually delivered a baby girl. This particular remedy, this particular case, you can see the video. This case was a woman who was able to conceive, but every 5th month she would abort, and this is a child that she could retain for 8 months. She was born premature, but at least with the homeopathic remedy, you can see, and there's a video testimonial of the mother talking of how the homeopathic remedy helped her. The remedy was very, very simple, but you can have just listen to what she's saying.
बाळाला घेऊन जायचं, पण पुढे वाढतच गेले ते 4-5 महिने त्यातच गेले, आणि माता झाली होती. पप्पा सारखे बोलायचे, तर मग म्हणजे थांबा जरा व्यवस्थित होत्या, मग जाऊया मानवले जरा धरायला पकडता पण येतं. मला चांगल्या वाटायला पुन्हा त्रास व्हायला लागला. आता जरा 8 दिवसात जास्त ते काय सुजन वगैरे कारण तिला तो आजारच आहे ना भरपूर संधिवाताचा, आणि मग आता ते उभं राहिले की एवढे सुस्त्यात पाहायला बाळ भेटताही पण म्हणजे आपल्या हाती बाळ येणं महत्वाचं होतं. पुढचे आजार ते आपल्याला
So you can appreciate the fact that she could continue the pregnancy for at least 8 months. Previously it never continued beyond 5 months. So in fact 3-4 times she had done her os tightening. In spite of that, she could not retain the pregnancy. This time we gave her homeopathic remedies. We did not do any os tightening, etc., but she could sustain that pregnancy for 8 months, and at the end of 8 months she delivered this particular baby girl. The remedy which was prescribed for her was Sepia as one of the main remedies. She also got Syphilinum to begin with because of the history of repeated abortions and repeated loss of children. But Sepia was prescribed for this particular symptom, which is abortion in 5th month. So we gave her Sepia, that helped her, and that was such a rewarding feeling because she had lost 3 to 4 previous children exactly in the 5th month. So this is how homeopathy can help a lot of women and a lot of couples who are struggling with infertility. Of course, as I said, we have to look at the cause, we have to look at the lifestyle, because because infertility is a multifactorial problem, and we need to address all these factors. So if there is something wrong with the nutrition, if there is something wrong in the lifestyle, there is lack of exercise, there is excessive smoking, excessive alcohol, all these things need to be taken into account. We need to take a complete case. We need to either prescribe the constitutional remedy, we need to give them intercurrent remedies, we need to give them specific herbs to improve the blood flow, etc. And with a combination of homeopathy, yoga, nutrition and lifestyle management, we will really be able to succeed with our infertility cases. So I hope this presentation was interesting for you. Thank you for listening. Bye bye till next time.